My name is Dr. Visula Abeysuriya. I am expert in public health and I am a member of Bandaranaike Academy for Leadership and Public Policies. Today I am going to discuss key health policy implications regarding two communicable diseases which arise in Sri Lanka. That is dengue infection and chikungunya infection. Before I dip into health implication policies, I would like to give a brief introduction on dengue and chikungunya. As you all know, these are communicable diseases which is mainly in tropical and subtropical regions. But now it has been western to other regions as well. What is the main cause for this? There are few reasons for this. First, urbanization, then climate changes, environmental changes, and global travel. As you know, the vector for dengue and chikungunya is a mosquito. We call Aedes. And the host is human. When you consider dengue, the pathogen is dengue virus. We have identified 4 dengue viruses. When it comes to chikungunya virus is the pathogen. Now, when you consider the symptoms and signs of infected patients, there are much similarities. Both diseases can have fever, body pains, joint pains, rash, and fatigue. There's a small proportion of dengue patients can go into dengue shock syndrome and dengue hemorrhagic fever. That is a fatal event. But in chikungunya, you don't see these fatal events, but instead of that, you get severe joint pains like chronic arthritis and remain for prolonged period to recover. So these diseases not only cause harm to personal life, it will have impact on socio-economic status of a family as well as country because it disrupts your normal routine. Now I would like to explain 5 health policy implications regarding dengue and chikungunya prevention as well as curative care. First is the surveillance system. That is the first health policy implication. Up to now, National Dengue Control Unit has reported nearly 20,000 dengue cases has been recorded in Sri Lanka. Highest is Western Province. And Epidemiology Unit of Sri Lanka also said chikungunya cases have been reported in various parts of Sri Lanka. I must thank both National Dengue Control Unit and Epidemiology Unit and Ministry of Health for their pivotal role in surveillance. We can improve this surveillance system by adding artificial intelligence, which help more accurate predictions as well as to find hotspots. The second health policy implication is capacity building, human resources, and logistic facilities. As you know, epidemic like dengue and chikungunya will stretch health services into maximum level. This will upright a question the provision of quality services. Therefore, we should be preparedness for these emergencies. Third health policy implication is multi-sectorial approach. As you know, dengue and chikungunya has a common vector called Aedes. That is a mosquito which breeds in shallow clean water. Sewerage lines, water flow areas should be tackled here. This helps for prevention. This needs urban development authorities, other educational ministries to accompany with health staff and jointly battle these diseases. Third health implication policy is awareness. This is the most important one. As you know, chikungunya and dengue is a twin attack. So, we must educate communities to identify how to do preventive measures, how to identify common symptoms and signs, and when to obtain medical advice as if necessary. Final health implication policy is research and development. As you know, we should invest more funds and resources on research and development. It should rise to level to achieve vaccine development as well as drug development. So these are the 5 key areas of health policy implication I would like to share with you. I hope you gain some knowledge from my brief introduction and wish stay safe, stay informed and help to build healthy Sri Lanka in future. Thank you very much.